Telehealth is technology that allows us to monitor clients' health. So it remotely sends back information that we or the customers put into the machines back to a head office that collects the data that allows us to assess their health. A lot of our customers have many complex health issues, and it's a way of monitoring and keeping an eye on our customers in between doctor's visits and in between hospital stays. It's a way of being able to monitor that, but it's also a way of the customers being able to self-monitor so that they can keep an eye on their own health and live a relatively normal, healthy life at home, because that's what our customers want to be able to do, rather than to go into care and someone do that for them. This actually allows them to stay in their own home and to monitor their own health and then make decisions about their own health based on what the information is telling them. So what it does is it's a little machine that sits in the client's home that sends through the phone line into a medical facility that actually records the data. So there's a health interview every morning that the clients are asked questions about their health. They're asked things like how they're feeling today, do they have any symptoms today, so have they got a cough, or are they feeling dizzy, or are they feeling unwell, and that information gets fed back. It also has technical data that it feeds back as well. So that could be your blood pressure, your blood glucose level, that could be your oxygen level, or your weight. And all of that information is fed back so that we can actually monitor the customer's health remotely to make sure that their health needs are being cared for. And we actually tailor each telehealth program to each client. So we assess their health needs and combined with the GP, and we work out what sort of level of health that we can expect from our customers and what sort of limits and things are set so that we know what's an acceptable range for each client or each customer to actually work out their health needs. So there's a big education piece that goes into that. So when they're installed, all the customers are actually taught all about the equipment and the setup, and they're actually taught how to use the technology themselves. And for many customers, that's the first piece of technical equipment that they've ever used, and they really do embrace it and really do love to know that their blood pressure's great, their weight is stabilising, that their blood sugars are great. Often they'll go to the GP and the GP will take their blood pressure and never tell them what their blood pressure is. So this is but put them on blood pressure medication. And so they wonder why they're on blood pressure medication and wonder what their blood pressure is. So this is a really good way for them to see every day that their blood pressure is okay. And if it's not okay, then that information gets fed back to myself, and then we organise a GP visit, and the GP can assess the customer's health and determine whether there needs to be a change in their medical plan. So it's really a proactive way of actually monitoring a customer's health and hopefully preventing a medical event is what we're trying to do, and prevent a hospital admission, because really most of these customers want to be at home. They don't want to end up in hospital. They've been through enough through their life, and if we can monitor and prevent that, that's what we're really trying to do. So the training today is about training the carers about the assistive technology. So the equipment's in the client's home, and most of the clients are actually using the technology themselves, but may have a question or two about the equipment. So it's really about training the staff so that they understand the piece of equipment. So if they've asked a question, or if they do need to assist a customer with the readings, that they're actually able to do that. And it really relieves the customer's fears knowing that the carers are well trained, and it also really makes the carers feel special as well, because they're actually involved in the care and they can actually answer questions. So if they're asked a question, they're able to answer, and then they're not afraid of the technology if they're actually willing and able to use it. So that's what the training's all about today.